NEHAWU has confirmed that it will go ahead with its plan of action that includes a stay away, pickets and a possible strike over PPE shortages. Our reporter Mbali Thethani is following the story for us and joins us live. Mbali, we heard there NEHAWU outlining the 7 steps that came out of their report and saying that those do not seem to have been taken seriously by leadership. Saying that even in the meetings that they held, no reference was actually made to the recommendations that were put in that particular report. If you could highlight just some of the key issues and some of the key demands that NEHAWU has that, should they continue not being met, will result in the unfolding of this plan of action.
Well, of course, Tami, NEHAWU says that it has raised its concerns with the relevant ministers in the health care sector as well as the public administration, raising issues around the protective equipment for the frontline workers, saying that they continue to complain around issues of PPEs, saying that there is not enough PPEs during the scourge of the coronavirus. They've also outlined their program of action, of course, this afternoon, saying that it is expected to start from Monday. But just to give us more insight and give us more information around this protest of action and who it actually involves, we are joined by the GS of NEHAWU, Zola Sapeta. So I just want to find out from you. You are saying that you've been left now with no choice. You've held meetings with the health minister, you've held meetings with the social development minister, but it seems as if nobody's willing to come to the fore and hear your pleas.
Yes, we have met them, but there's nothing to take home. It's just one of those talk show kind of meetings, yet our members are dying, are getting infected. So anything that is less than resolving the issues, we don't take. That's why we are forging ahead.
And if you can just give us insight, you've outlined today that it is expected to start from Monday. You are expecting your members to apply for leave. Who is involved in this protest action? Does this also involve frontline workers like nurses?
Yes, it involves all members of NEHAWU and general workers in all sectors where we organize. Government, parastatals, private sector. All of them, they must be part of this, including frontline workers, particularly them, because they are highly affected. So that's what is happening Monday. We're applying for leaves for 25th, but also conducting at the same time picket demonstrations as a signal or as a warning shot to government that if they don't resolve these issues amicably as soon as possible, we'll be left no option but to go for a full withdrawal of our labor. That's what really this message is about.
And of course, this is expected to start from Monday, and you are saying that should it not be heard, there will be a full protest come September.
Certainly, at the peak of this virus. On the 3rd September, we're going to the President and the National Speaker of the National Assembly and premiers in all provinces to submit our memorandum of understanding, and then we'll await for them, give them 5 days to respond, failing which, unfortunately, on the 10th, we are not going to go to work.
Are you not concerned? I'm sure viewers at home are asking themselves that during the scourge of this pandemic, during the peak as well, are you not concerned that the ramifications of this protest action, we understand that health care workers don't have enough adequate PPEs. Are you not concerned that what it could do to the country? We continue to see more people dying on a daily basis. Are you not concerned at all that this will cause another major increase?
Certainly we are concerned. That's why we are taking this decision, because frontline workers are dying as we speak, and frontline workers are infected with the virus, and it means if there is no measures or mechanism to avert this, by implication it means the public will be infected and die as well. So we needed to take this kind of an action in order to bring to senses of government that there's more to be done to save lives of frontline workers, by implication save life of the nation. So we are concerned. That's why we have chosen this. People are dying and they will die tomorrow. And we need to come together and say, let's find a way to avert death. That's what really this nation is about.
And when you look at the statistics around healthcare workers who are passing away, who are dying due to coronavirus, and you look at the public healthcare sector, how bad is it?
It is bad. Though we disagree with the stats published on daily basis by the minister, but if you take these stats as of 4th August, you will see that 27 plus public health and frontliners are infected, and out of it 1,644 doctors and 14,000 plus are nurses. And he was saying yesterday 204 who died, which we contested because we get information on daily basis from workers and so forth. But those numbers are too high. They must be concerning to everyone. And we want the nation also to be concerned, because if no one is concerned, no one will save the nation. So we say, let's stand up today, together with the society, to fight against this and reason with the government so that we save many lives. So that's what really we are saying.
All right. Thank you very much. Thami, that is Zola Sapeta. He is the General Secretary of NEHAWU, just talking about the protest action which is planned from Monday. And of course, we understand that workers are expected to apply for leave. We will see healthcare workers on their lunchtime pickets. And then this will generally lead up to a much bigger protest that we'll see come the 3rd of September, saying that, well, I asked the question around issues around, well, aren't they concerned that if their workers do go on this protest action, how it will affect the healthcare system? We know that during the scourge of the coronavirus, healthcare workers are essential services. They are at the forefront of fighting this virus, and basically saying that, well, it is those frontline workers who are passing away. It is those frontline workers who are dying due to a lack of PPEs.